And the result may look so natural, but the change is so profound.
I think the biggest overall trend is more natural results, and we could talk about that more in breast, body, and face, as well as this use of the word undetectable.
Because the results are just increasingly so natural.
Patients may not want to actually have a bigger procedure, they'll want a smaller procedure.
The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome to the Beauty Scientist 2025 edition. I'm Dr. Christy Hamilton here with Dr. Roy Kim. We are board certified plastic surgeons, and it's a new year, so we're talking about 2025 surgical trends. Happy New Year, Roy.
Happy New Year. So, how are you doing, Christy?
Great. With the end of each year and the beginning of a new one, we're always thinking about what's new, what's changed, what's on the horizon. And I know we both have noticed some, I don't even like the term trend necessarily, but just a progression or an evolution of the aesthetic in our practices and what is currently piquing our interest. What is going to be on trend for, and this could be a progressive trend for 2025?
I think the biggest overall trend is more natural results, and we could talk about that more in breast, body, and face, as well as this use of the word undetectable. So I think that's huge.
Yes. And we've seen, I think, an increase or an uptick in surgical procedures in general across all generations because the results are just increasingly so natural. Patients are seeking earlier interventions because they know they're not going to get a windswept face look. They're going to get the ballerina body of their dreams. Why wait for that? I think natural and undetectable are the keywords for 2025. And that's really a continuation of where we've been going for the last couple of years. For face, I love undetectable and natural. And then for body, I think we're still seeing this ballerina body aesthetic. So long, lean, athletic, kind of like the Pilates body, yoga breast. Those are all terms that my patients are asking. And so, and it's not that fuller, more voluptuous breasts and hips are gone, but I think patients are seeing like, oh, I can have a breast augmentation without having a really, really full breast with lots of cleavage. I can come in and have a tiny 150, 200 cc implant. There's just more options, more aesthetic options than there were before. What about in like surgical trends and innovation? Technology.
Yeah, I think the sort of less surgery, more invasive trends are definitely going to increase, where patients may not want to actually have a bigger procedure, they'll want a smaller procedure. They want a procedure or they need a procedure where they have loose skin and there's no technology that's going to tighten a decent amount of loose skin, but they may get that procedure a little earlier. I'm thinking facelift, neck lift, even eyelid lift, where technically you need one. Technically, you're at a younger age, and non-invasive stuff simply won't tighten up the skin enough. So you will go for a smaller facelift, smaller neck lift, eyelid lift that's less skin excision. And to be honest, not that many people may notice a dramatic difference, but you as a patient will. But that's sort of the whole point in terms of more natural results, still rejuvenation, and obviously less swelling and less recovery time after the operation. Have you noticed that in your patients?
Absolutely. And so, and that's what they say. They come in, they're like, like, no, like people just like they're looking, you can tell if they're looking at me, like they're like, you just look refreshed, but they really can't put a finger on it. And that's the big difference between having a facelift or an eye lift in your 30s, facelift maybe in your 40s versus in your 60s when you like really have a jowl and suddenly that disappears. Then it's like, there's no question that, and the result may look so natural, but the change is so profound that everybody's going to know versus if you're just seeing like hints or the beginning of these changes and tissue descent and laxity, or early extra eyelid skin. Then if you go in early and do that, then you just look brighter and awake, but no one can really tell did she or didn't she. And I think patients are increasingly encouraged when they see on social media, they see these before and afters, and they're like, oh, like you really can't tell that these patients had surgery. Gives them so much more confidence to do these procedures earlier. So for one of the women who works in my office, she's like in her late 20s, like beautiful. She's a model as well. And we just did a kind of mini brow lift, lip lift for her. So we dissolved her lip filler so she doesn't have that anymore, and a breast augmentation. And, because the changes were small, she like 3 days later was like back modeling, just
Right.
with a little bit of concealer on like her lip lift scar, and she loves that she doesn't have a filler there anymore. So it's like less maintenance for her. So I was like, that's, to me, totally different than where we used to be, where I think if you were hearing like 28-year-olds having brow lifts and lip lifts, that maybe would sound wild, but she's just thrilled, and it really is a subtle change that I don't think anyone would know she had surgery.
Yeah, we need to come up with a good catch marketing phrase between you and me because, yes, patients are still getting a neck lift or facelift or eyelid lift, but that seems so harsh and people expect sort of a big change. And that's true if you have lots of loose skin, sun damage, aging, and you're in your 60s. But it's definitely possible, but at a younger age, less skin excess, less skin laxity. But I mean, as a surgeon, you and I both know we're not removing that much skin to excise. And we still do shaping. We still care about the overall results. Fat grafting has increased. So the ability to sort of mask some of the harsh edges with breast work, especially, fat grafting is wonderful. But we need to come up with a catchphrase. I don't know. I don't love the phrase mini lift, although we could say that. Subtle lift, undetectable lift. I don't know.
Undetectable. I know, because patients always come in, they're like, oh, like the mini. And I'm like, mini really is. It's like just like a marketing term, is you're still going in, you're doing the same operation. It's just like the results are mini because the need is mini. But it's not like, and I think patients also like hearing like, oh, I'm not having like a full facelift. I'm having a mini facelift because I'm not old. And you're like, it's true, but you're still going in making the incision. So you're right. We need to come up with a way that really describes this well. But I like undetectable
Okay.
facelift, something like that. We'll think about it.
We'll
And
trademark
before
it.
we,
So
yes, we'll
charge people.
trademark it. And so before we delve into the like detail, what do you think is on its way out? What do you think we left behind in 2024, for better or for worse?
I think a lot of patients have gotten filler. And so we're sort of hitting the end point of maybe you got too much filler. Maybe you wanted an over exaggerated look and you're letting it fall away, get dissolved. And finally, in some patients, we sort of knew this, but so many patients have gotten filler that we're seeing it in more and more people where, and I know, filler gets metabolized. It gets metabolized at X amount of rate. It lasts in your body, let's say about 12 months ish. And that's what the FDA insert says. However, it's a range where some people it may metabolize, less than 12 months. Some patients, it may be there for a lot longer. And there may be small amounts that are there forever. And then when you repeatedly get filler and filler and filler over again, then you may be adding more and more on each time you have a filler session. And I think that's on its way out.
Yeah, I agree. And I think what we've seen is just, for whatever the reason, just lack of education, lack of understanding, other motivations for like over injecting patients. So I tell patients, look, filler is still a great tool. I mean, it's great. You can really create structural changes, whether you're we want to augment bone structure, ones for like soft volume. I think once you're going in and like you see these courses where like this patient needs like 10 syringes, I was like, oh, I think when we're at the 8 to 10 syringe line, we really should start thinking about surgery rather than filler intervention, because like you really start to wonder like how much structural change do we need to these faces. And then you need to be seeing someone, a plastic surgeon or dermatologist, that has a really good understanding of facial anatomy, looking at you specifically in your face and getting a sense of like how quickly your filler is breaking down or not, so that you never end up in one of these like overdone afters. So I think, I got a little bit of filler all over my face. I love it. I think it's great. At some point when I'm older, I think fat will be a better option for me. But when it's just such small amounts, the ease of just pulling the off the shelf material and injecting it into my own face is great. But I think you just have to make sure you don't overdo it. But I think as surgeons, it's really exciting that patients increasingly are seeing the value of these surgical procedures executed very well, and how that just gives a lot more longevity and specifically for things that are more like the tightening or the redraping of tissues, like this patient understanding now that we have, or the consumer understanding that volume isn't going to do that. And so I think that's been like a positive of all this discussion on social media, although I think filler has maybe unduly taken a hit to its reputation.
Yeah. I know we both have mentioned fillers. What do you think the trends are in terms of fat and fat grafting to the face, to the breast, to the body for 2025?
Oh, I think fat's skyrocketing. I think, people have kind of gotten scared of filler, or felt like they had a bad experience with filler, like fat is nature's volumizer. I mean, that is nature's original filler. And as we see more and more Americans or around the world, like more and more people in general on these GLP-1s losing a lot of weight, like Ozempic and Mounjaro, I think we're seeing a lot of facial fat loss, and fat in the face is so rejuvenating. It's a minimally invasive procedure. So just like you're saying, like patients, like they love these small wake procedures they can be, and just that, instead of pulling a bunch of material off the shelf and having that increasing syringe cost, we have most of us have abundant fat that we can borrow from other parts of our body. And so then we can really optimize the face from a volume perspective. And I love pairing that with an aggressive laser resurfacing. And that's kind of like my pre-facelift rejuvenation. So we're not doing any like structural tightening, but we're getting like a really nice cinching of the skin, improvement in like lines and wrinkles, and then appropriate volumization of the face where we've lost some. So is that a trend you've seen in San Francisco too?
Yes, definitely. Where fat is increasingly being used in the breast, I'm very surprised by the good results, actually great results we're both getting, where we're still doing breast implants, but we're adding on fat grafting to the edges that gives a more natural look. And we're not doing it just to get volume. But you've talked a lot about the Miami thong lift, where we're not going for these oversized BBLs or hips really out of proportion to the rest of your body, but rather a more improved, perky look to the buttock. But obviously, you still need some volumizing agent, especially in patients who have been on Ozempic or GLP-1 injectables. And really, there are exciting new technologies in fat alternatives. So specifically, if you may not have enough fat because you're so thin, you're on Ozempic too long, we actually have stuff that we can crack open from a sterile container and inject back into you, both called Renuva. Alaclay is on the horizon, and we'll see what else can be done.
Yeah, so that's really exciting because I mean, it's not been a problem for most patients thus far that they have no fat to transfer, but we're entering this world where we're going to have people that are like fat deficient. They are going to be probably muscle deficient, because when you have rapid weight loss like that, you're breaking down your muscle too. So we're going to be in this position where I think resistance training is going to be really important. Having like a high protein diet is really important. This is like something I've like my friend Dr. Gabrielle Lyons like really big into. And so like how can we like optimize our wellness and longevity? And plastic surgery is going to have a big role in this too, because, like you can with diet and exercise really make big changes along with these medications for your health and wellness. But that skin, once we have all this extra skin that's there, like you can't exercise that away. So I predict there's just going to be like an overwhelming amount of body contouring surgery in the next couple years while we're kind of like right sizing the obesity epidemic we have in the United States.
Yeah. One thing you mentioned, I've noticed, is the floating belly button. So this is important because obviously if you lose a lot of weight, you're not really a candidate to necessarily have this technique. If you've lost maybe lesser weight, or really we're looking at the lax skin above and around the belly button, there's a technique that actually is technically scarless around the actual belly button itself. If you could talk about the technique and who the ideal candidates are, because again, this sort of addresses people, hey, if you're losing weight, if there's GLP-1 injectables or natural weight loss involved, you may or may not be a candidate for this option.
Yes, it's funny how all these surgical trends or surgical techniques, many of which are very old, like this one, like suddenly like go viral on TikTok, and then all of a sudden like everyone's asking about it like it's new, and we're like, oh no, this is not new. So the umbilicus is what we call the belly button. That's our surgical term for, or our anatomical term for the belly button. And so floating is the surgical technique. So what does that mean? So the belly button is attached to our core muscles. So when we are starting our tummy tuck, making that low incision and dissecting up along the abdominal wall or the ab muscles, we will hit the belly button stalk. And at that point, you've got two options. What we normally do in a full tummy tuck is we make a cut around the belly button on the skin, separate it, and so it remains attached to the core muscles deep. And then when we pull down that skin, when we finish the dissection and we're seeing how much we can remove, we'll then pass that belly button stalk through the skin, kind of create a new home for it, is the way I like to describe it. But that belly button was stuck to your core the whole time in its original position from birth. The floating one is a little bit different concept. So that's where we cut the stalk of the belly button. So we leave it instead attached to the surface of the skin and separate it from its attachment to the core, the abdominal musculature. So now it can move with the skin. So when we pull it down, we advance that skin down and see how much extra we're going to move. We're actually going to pull the belly button south. And so there are, and I think you'd agree, very few candidates for this procedure, which is why you don't see as many examples of it. But the person that it's good for is someone who probably had kids. This was probably a postpartum woman where really they just had a more skin excess at the bottom of their abdomen, not a lot of stretching of the top, and someone who naturally had a very high belly button placement, because there's a range of normal placement of the belly button, whether it's higher or lower, so that they can stand to have it move down a little bit and not have it look weird. Problem is, most people, when you pull down their belly button, then your belly button is going to end up closer to your pubic area if you're really going to tighten everything up. And then that just looks weird. Patients love the idea, I think, because you don't have a scar around the belly button, but most people are not going to be great candidates for this procedure.
Yeah, I mean, for the viewers and listeners out there, this is a great technique, except most people aren't candidates, as Dr. Hamilton said. Usually the way that we do it is actually we make an incision around your belly button and it's still attached to your abdominal core muscles underneath. We lift up the skin over it, pull it down. So where's the belly button? It's still there. We have to make a new hole, if you will, to bring out your belly button. And you are totally correct. Anatomically, most human beings, where your belly button already exists, it doesn't matter if it's stretched out, pregnancy, weight loss and weight gain, all that good stuff. Your belly button actually most of the time is in a great position. You have a lot of loose skin around it. And so we have to bring it through a new hole and get rid of the excess skin around it. Most times, we are not making the belly button like higher this way, and we're not trying to lower it the other way. We're just trying to keep it where it actually originally is. So, as Dr. Hamilton said, if it's a little too high, like towards your rib cage, and pulling it down makes it a more normalized location, fantastic. But that's not really that common.
Not common at all. I think like last year, I do a lot of mommy makeovers, big part of my practice, a lot of tummy tucks, and I did 2 of those. And one of them, the patient was a better candidate for the full tummy tuck, but she was just like, could not consider the scars. So I think I told her, it was like, well, it's going to be a nice improvement, but you're not going to get as like chiseled and contoured as you would with a full tummy tuck. So, and I think, you look at what we can do with belly buttons now, those scars around them, and like really, we can do a really good job with those now too. So you really just have to consider, listen to your surgeon, like hear what makes your anatomy favorable or not for these different types of tummy tuck techniques. But there's a reason why we mainly are doing the full tuck. But that's a fun TikTok trend. I wanted to talk more about, because I think this is like a really powerful technique that you were talking about when we were talking about fat transfer to the breast, and how I think alone as like the only surgical technique, fat transferring the breast, like it works like medium well. You have to have enough like breast tissue to receive a lot of fat. And then of course you have to have enough fat to give. And so we get like a nice enhancement, but it's more conservative. But I think what you were saying about the combination of the breast implant with some fat transfer for contouring, like I think that just is like, it's like the Michelangelo of like breast surgery technique. Like what do you love about it? Because I love it a lot.
Really, I love the edges. So, as we both know, breast implants have gotten better and better. We've discussed, especially Motiva breast implants recently, but you can still see the edge. And that is technically, to our eyes, not very natural. It looks great. Obviously, under clothing, it looks good. Underneath some like mild to moderate cleavage, it looks good. But if you have deeper cleavage, if you have very little to no breast tissue to start off with, yes, you can sort of tell that there's a slightly sharp edge there that you and I, it's a giveaway that you've had breast implants. If you can soften that edge a little with fat, and the fat sort of makes that hard edge moderately softer to very softer, then suddenly in any outfit, you can't tell if you've had a breast implant at all in terms of visual appearance. And of course, look, hey, these implants today, they feel very natural. But if you can mask the edge even more, and you're talking about a smaller implant and it's not as big of a volume implant as we've used in the past, and you're still getting the same or similar overall volume with a softer edge, at that point it's very hard to actually feel the edge of the implant or feel any implant like at all, which this is why we love fat for
It's just
breast
so nice.
augmentation.
So it like literally comes back to that undetectable trend. It's like the undetectable breast augmentation. Like you really, really can't tell. And I love that like increasingly with that, we're able to transform patients that we're going to have their implants under the muscle. Like now maybe we can place a lot more of those subfascial or in front of the muscle with some fat transfer along the edges. And then they get kind of the benefit, best of all worlds. Like your muscle isn't cut. You have a really fast recovery. You're truly augmenting the gland of the breast. You need a smaller implant because it's not being squished by the muscle as much. And then the only downside really was, capsular contracture, which we've got a solution for that now with the Motiva implants, like that visibility. And so if then we can really customize the breast augmentation, and every woman's cleavage lines are different, but with the fat we can inject it where we want it and really sculpt the breast shape. Like the implants come in like the sizes that they come in, they're round. We can't place them where we want, but then we can't make like these like small adjustments to the shape of the implant after. So I think that's really fun. And I think it's just unlocked breast augmentation as a surgery for so many more women. So that's what I've been seeing. It's not that like all these, there's still plenty of women that want like a fuller augmentation, but all these women that came in that just were very, very thin or had very little breast tissue, now we're like, oh, we really can give you a natural breast augmentation look, and you're not going to have something that looks like obviously done, because that's not what they want. They want something that's really conservative.
Yeah, I've come up with a new catchphrase: the undetectable hybrid breast augmentation.
That's what it is. Undetectable hybrid breast augmentation. Yeah. So I think that's fantastic. And I think it really explains it. And it's like the marriage of like all these different techniques and the relative like benefits of all of them like combined into one for something that I think is like, it's a really ideal way to do breast augmentation if you're a candidate.
Yeah. I think we need to change the order of the words though, because UHBA is UBA, which is sort of weird. If you change it to hybrid undetectable breast augmentation, then it's HUBA
Oh,
or
hubba
HUBA.
hubba.
Yes.
Perfect. I love it.
So we can call it the HUBA procedure.
The hubba procedure. That's great.
Yeah.
Yeah, I think no, we do need to give a name for it, because like I'm always just like with like breast augmentation, like plus the fat, like maybe the internal bra, like custom, and it's like it's patients get it, but we should come up with the hubba. Yes, that's good. So they know
Okay, we'll
they know
call
what
it the
to ask
HUBA.
for.
And we'll trademark it and we'll sue anybody who uses it. So they're too bad.
Yes, proprietary. So,
That's
but
right.
yeah, I think that's like, I love doing those. It's so fun that they look so pretty. Like the next day they look good. That's like, they don't have to wait 3 months to like love their breasts again. It's like, it's really, really been like a game changer. It's like totally changed my breast augmentation practice. So
Yeah.
it's neat.
I mean, smaller implant, subfascial placement, less skin stretch, no muscle stretch. Then you got the fat grafting, which is very subtle but hides and masks the edge. So the pain control is a lot less of an issue. The recovery is a lot faster. The results look very good, like better like the next day or two, but increasingly improve over time.
Yeah. It's like,
Yeah.
that's great. It's like almost like we've like solved this operation. So it's good.
Yes,
I'm
we're
excited.
definitely solving it. There's no question about it. It's definitely much better.
Yeah. So it's kind of funny because you look at like, breast implant trends and like we increasingly hear like, oh, like everyone's like taking out their breast implants. And I like, when I was, we're both social media chairs or editors or whatnot for various journals and associations. But when we're talking to the media about it, I was like, but just keep in mind, like breast augmentation has never been more popular. It's just that we're also doing all these other things too, like women taking out their implants, doing fat transfers, doing lifts, whatnot. So I think just like breast surgery for women is increasingly popular. They're just realizing that there's so many different options for them and so many different ways to attack whatever the concern may be. So I think definitely like an era of breast surgery in general, whether it's lifts or augmentations with that or implants or both. So it's exciting. I love doing these operations. So these trends are very much in line with my practice and what I like to do. So I think that's exciting as well.
Yeah, same with me. I love it. And I love the new technology. I love learning something, but then applying newer principles and being creative to give patients the best result.
Best result possible. So we are here for it. The undetectable trends, ballerina breast and body, just really, really natural, unoperated look. The beauty scientists have got you covered in Houston and San Francisco. So stay tuned for our future episodes. There's so many exciting things to talk about this year, 2025. If you have any questions, drop them below in the comments and we will do an episode on them. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.